As if contending with the coronavirus pandemic wasn't enough, Nigeria's hospitals are about to face even more challenges. Resident doctors across the country are going on strike. They're fighting for better working conditions and are demanding payment of overdue salaries and allowances. They say the government isn't listening to their demands. These doctors account for more than 80% of the medical workforce. Without their support, consultants can't manage the workload and patients are left unattended to.
Some state government also have not paid its members, some owing them up to 19 months, some 10 months. And these are part of the things which government had agreed they were going to intervene, to ensure that our members were paid. Beyond that also is the Residency Training Act, which government also had agreed they were also going to pay, which we are yet to see for the 2021 year.
Many of the problems facing the healthcare system can be linked to a lack of proper funding. Less than 4% of Nigeria's 2021 budget is allocated to health. That's despite a pledge made in 2001 to allocate 15% of the budget to healthcare. This is the third time this year resident doctors are going on strike, but it's changed little in the past. These resident doctors now want long-term solutions from the government.
Government also needs to do the same thing which we have in the judiciary, where a certain percentage of the budget, a substantial amount of budget, is constantly kept exclusively for healthcare. It has to deal with remunerations of staff, equipment, creation of maintenance of equipment, and it should not just only be limited to the federal government. It should also span down to state governments.
Millions of Nigerians struggle to gain access to adequate public health services, which are often free in other countries. Now, resident doctors are hoping their strike action forces the government into improving healthcare for all. Evelyn Akaka, Arise News.